Tuberculosis Day. Let's conquer tuberculosis together. We are going to have Minister of Health of Ukraine, Oleksandr Kvitashvili, Natalia Nizova, Director of the Ukrainian Center for Social Dangerous Diseases, and Andriy Slavutytskyi, WHO representative in Ukraine. Good morning. We are mark today the World Day of Tuberculosis. The situation in our country, amongly speaking, is not very good. Every year we reveal about 30,000 new TB cases. This is a very high indicator that the most danger is that 20% of this figure is not revealed. So people suffer from TB and their condition deteriorates and they are not revealed, and it's very difficult to cure them. In general speaking, this situation is very dangerous, hazardous to Ukraine, to the health of the people. I know this topic very well because I myself had TB. That was a real unpleasant surprise to me when during the routine medical examination in one of the outpatient clinics, TB was diagnosed with me. So 4 months before that, I had an open form of TB, and then owing to the high immunity I had, I managed to conquer that. But I had to undergo treatment, and treatment is very, hard. The most important not to stop and not to, to surrender to that. And I try to convey this message to everybody when I speak from some kind of the rostrum or the platform. I always say that TB is a very serious disease, but it's curable. And there are all the necessary opportunities for the modern medicine to cure that. But most important not to stop the treatment and to undergo the complete cycle from the very beginning to complete this. And for several decades I've been absolutely healthy, and I never have had any problems associated with TB. I would like to emphasize that TB is not a disease which this is not a social dangerous disease. This is this is a normal disease when people, well-to-do people who actually live in good conditions, they are still at risk. And all of us, we have to do only one thing: to develop, to further improve these public governmental programs existing today, with due consideration of our situation today and the warfare in the East and the movement of many risk group of the people. We have to develop necessary programs. We enjoy support of the Global Fund, who has been actively working in Ukraine for many years now, because TB is not a separate country, not the disease of a separate country. And since we are part of Europe, naturally, for the all the Europeans, it's very important that the whole territory, which is called today Europe, be vacated or be free of TB. So, in addition to diagnose properly and to offer proper treatment, all the people have also to realize, understand properly what it is all about. And but this is curable disease. Once again, repeat myself. But the physicians, the doctors, have to diagnose it properly, and the people who suffer from this disease have to undergo the whole cycle of treatment. And if you know better the situation, we can prepare all the necessary measures, countermeasures to take care of that. Today in Ukraine, there is an organization which is instrumental in assisting our country, our ministry, to implement the large-scale project against tuberculosis and the information campaign, which we really need. I think we are going to take care of drawing up this public campaign, which will help people to increase their awareness, how to prevent it, how to take care of that, and who they have to approach it or address to. Thank you very much for your attention, and give the floor to to Tatiana. Maybe, first of all, Andriy will have the floor. Dear friends, the global strategy of the WHO to eliminate TB was approved in September last year, which makes for a vision till the year 2035 to eliminate TB, which is very detrimental to the health of the people. Strategy is based on three approaches. The necessary approach to ensure such a situation when the system will work for the patient and not the other way around when the patient works for the system. Another component of this campaign to create the environment which would support the patient-oriented approach and the decentralization of services provided and their integration into the primary level of medical assistance. The third element of the strategy makes provision for the creation of powerful opportunities for the different actions to be taken and the accelerated introduction of innovations. It's necessary to better understand the nature of TB in order to determine properly the priority and to more efficiently make investments. Today, Ukraine works on the development of new national programs to combat TB for 2017-2021, which is based on all the components of the plans of action of the European region. For the last few years, Ukraine places the second in Europe and the fourth in the world. If we are talking the burden of multi-systemic TB. In addition to that, the conflict in the east of Ukraine, contributed to the movement a large number of people, which actually deteriorates the situation. So, we are talking about the long-term efforts to be taken, but we have necessary means. We have experienced experts. We have the size of Minister of Health and the population who are working now on creating necessary efficient medical models to provide the assistance and the necessary resources which are required, to reorientate the treatment. Patient-oriented approach. So the slogan of our fighting against tuberculosis is let's pull our effort to combat TB. We cannot do that on our own. We need mobilization of the whole civil society. We are at the beginning of the road. We have to introduce a very reliable chain in order to provide the assistance to patients, starting from the suspicion for the diagnosis, for establishment of the correct treatment in order to ensure the reliable treatment up to the complete rehabilitation of the patients. For this purpose, we need to ensure the continuity of the assistance help to be made, of medical aid. And there are different organizations who can contribute to the experts of the health, both civil and penitentiary sectors, different experts to different levels, and social workers and governmental agencies, not only medical, but also administrative managers and those who are involved in, in prevention and treatment to be, and to achieve the ultimate goal to return or to reverse, let's say, this wave of TB towards complete elimination of this disease. It's very important to reach those people who mostly suffer from TB. Very often they have, in addition to TB, they have the accompanying the diseases, HIV, hepatitis, or drug addictions. And here, today, we have to pool our efforts in order to provide necessary assistance and aid to those people to unite in order to eliminate TB. Thank you. Dear friends, esteemed colleagues, just following up the messages which have been voiced by my respected colleagues, I would say that the peculiarity of this problem is really very serious, and due to the well-known circumstances, the risk of the situation is rather high, remains to be high. Before the start of the military conflict In Donetsk and Lugansk region, we had 15% TB patients out of the total number for Ukraine. Today, we have over 28,000 patients suffering from TB, including 10,000 of those who have this, what is called multi-resistant TB, which is resistant already to the treatment using the medications against the sensitive TB. That means that the economic burden on the country is being increased because the course of treatment of the sensitive TB costs about 40 hryvnia per patient, while the course of treatment of the multi-resistant TB is more expensive, tenfold more expensive. Today, due to what has been said by the ministry, 20% of the patients are not diagnosed to have the TB, or those who actually abandoned the treatment. We face another problem, the so-called TB with a broad medical resistance, which we do not have enough resources to treat, not only in Ukraine but the world over. That's why, while working on the drawing up of the national program, they pay attention first of all to the economic use of the available resources in the country and efficient utilization of the available resources and funds. Together with WHO, we calculated that the number of the entire TB establishments and institutions, they have 16,000 beds. That means one bed for two patients. Neither country of the world has this big for the patients. And a lot of money is spent for construction of such establishments and their heating. That means that over 15% of such medical institutions do not meet the requirements of the infectious control. That means that a priori, a patient who is hospitalized in such a hospital stands the risk to get or to be infected by some other infectious TB. That's why we try to reduce the low efficient, low powerful anti-TB institutions in order to provide jobs for all the medical officers. Over the last 5 years, they reduced the number of the TB patients' beds, but the quality of treatment did not suffer because of that. Number two, it's combination of infection and TB. Unfortunately, every 6 a patient suffering from HIV also suffers from TB, and this is a huge problem. You are talking about the quality of life. Unfortunately, over 5,000 patients succumb to tuberculosis every year, and again we are talking about some kind of the joint pathology, HIV, TB, drug addiction, and other diseases. And and this is again we are talking about the introduction of the approach, which has been voiced by the minister, his team. The patient of the centralized model, when we have a patient with a number of his problems but no specific disease, the treatment of which the huge money or huge funds are allocated not efficiently at that. And also we have to accelerate the introduction in Ukraine, the efficient strategies, treatment strategies. And despite the very serious economic challenges, the Minister of Health, and together with the WHO and the USAID, they introduced new anti-TB medical preparations, which has been already used in helicquinum and the laminitis, which first of all reduce the period of treatment. For example, we are talking about a resistant TB patient. He is undergoes treatment for 18 and 24 months, but those preparations will allow us to reduce this term down to 6 months. In addition to that, they stand a real chance to become healthy again. And we're talking about those patients who were believed earlier incurable. Thank you very much. We have the question and answer session now.
Good afternoon, Independent Trade Union. Is smoking a factor for TB? And if, for example, a patient smokes, how does it influence the process of treatment? Thank you for your question. Smoking reduces efficiency of the immune system, and a strong immune system leads to faster and efficient treatment. And patients who have different factors of risks. Smoking reduces immune system and the function of lungs that are affected by TB bacteria. Of course, smoking influences the process, and a priori, this is a problem. It is an axiom that this is real a problem. I have a question to Mr. Kvitashvili. What are the medicines for TB? And they said that there are some new medicines. Several weeks ago, they spoke about it in the Ministry of Health. What are these medicines and how the patients are treated by these medicines? Treatment is free. All the medicines that are needed, they are in the country. We procured through international organizations. And we bought some medicines for TB, to treat TB. And there is fantastic economy. We were able to buy more, much more. And speaking about this, I would like to stress we saved a lot, about 50 or 60% difference in prices. We will present this information after the contracts are signed, and then we will provide this information, and you will be able to see. It is, that medicines that we spent less for more meds and bought more medicines, and these are the companies that took part in the tender this year. They proposed medicines for lower price. Corruption was prevented in the sphere, and we eliminated all intermediary, and the international organizations helped us in this process. And also there were some tenders, local tenders, not through international organizations, that the Ministry of Health carried out last year. And the journalists who know about this topic, there were no scandals about this local procurements. And this year, we will do some procurement through international organizations, UNICEF, UNDP, and Crown Agency, that helped us to bring more medicines to the country for the money we have. And here, ratio between price and quality is really good, and is better than it was last year. And there was a campaign against these international procurements, but you should address us on these topics and to international organizations that procure medicines. And you should not believe those web resources that provide incorrect information on this. And what about the medicines? So they are present in all the hospitals. And what about Crown? This week there was a press conference in the Ministry of Health, and they said that something about oncology, that medicines will be in 6 months, and about TB you said that everything is in the hospitals. And are these medicines for all the regions? So we divided in international and local procurements. And we have some storage of this medicines in the country, and we knew that sometimes some time is needed to bring these medicines to the country. And these drugstores, they should also get these medicines. And we carried out a large-scale program to cover all the population that needs these medicines, and also considering the amount of AIDS medicines, we know that till the end of April we will have 100% cover of all the needs we need in the country, and in a week these medicines will be in the country, and the same principle was used in the transfer of TB medicines. And here I don't know who told you about the medicines for treating oncology. I signed the documents, and it's understandable that there is open market, transparent procurement, and some people are not satisfied with this because they earned through money on oncology, so it is not good for them. And of course, they don't like the idea to buy at low prices. It's understandable. That's why it is such a campaign that provides wrong information through different forms of websites and interviews or different information programs to discredit the system. But we are going to persevere, and we will do these procurements, and 100% will be 100% of procurement will be done through international organizations. I don't remember the exact sum, but we can maybe on the site of the ministry the information is available. 62%. 2.6 billion hryvnias that we provided to international organizations. I would like to add about TB, about new medicines, bedaquiline, lidozolid, delamanid. Everyone should understand that this is not some magic pill that reduce recovery. WHO, they say that you should be responsible while using these medicines, and the scheme of treatment should include minimum 4 effective medicines, among which there will be new bedaquiline or delamanid. And secondly, a patient should be treated for 6 months and should not stop the treatment. And if these medicines are not taken responsibly, so this is effective. These medicines are effective means for treating tuberculosis. And now in Ukraine, there is more resistance, and we should introduce the implementation of these medicines in a correct way. Good afternoon. Yulia Saloha. I represent the reanimation package of reforms. I am an expert of this civil platform, and also I am a coordinator of Coalition for Sober Ukraine. And I have a question to Mr. Minister. And we had a press conference at 10 a.m. and there were some doctors and civil society and reanimation package of reform specialists. We addressed the deputies not to vote for returning the advertisement of beer on TV. And we also invited the representatives of the Ministry of Health, and they answered from the ministry that this is a political issue and we won't comment on this. And I have a question. What is your attitude to the lobbyist initiatives that are peddled by in the Rada that to return beer advertisement that is equal to alcohol goods, and they want to return advertisement of beer 24 hours a day and on TV and radio and in places of sale. And do you support those who return who provide this initiative, and are you on the side of the civil society who counteract this? So you asked in such a way whether you are progressive or not. So I know that in many countries they reduce and limit time for the advertisement of alcohol goods. After 9 or 10 p.m. they start the advertisement. It's a normal practice, and beer, of course, is a part of alcohol drinks, but there are, of course, many lobbyists that influence the situation in the country. Those guys who produce so-called some potions with the use of some herbs that considered good for health, but there is about 18 degrees of alcohol. And I didn't see this advertisement on TV, but it exists. There are two aspects that should be taken into account. Advertisement is the profit for the companies of mass media, and it should be free. Advertisement is the most important factor to attract finances to the media, in order for them to be free, and that they don't depend on one person. And media should be free, and here we should find right model. We shouldn't ban this advertisement, but for example, when children are at home or they go to school, there shouldn't be advertisement of alcohol. So we should limit the time for the advertisement of alcohol products, not only beer, but other alcohol products, and all harmful substances. And also, I want to comment, beer is the problem, but also some antibiotics that are also advertised in the media, and they are harmful as well. And the regulation of advertisement is should be addressed on the whole. The last question. Good afternoon. Kucharczuk, Magnat Group. And there is suspicion on some cases of TB. And what are the manifestations of this disease, and what is the prevention measures? Thank you. This is a correct question. So, first of all, continuous cough during several weeks. It should be addressed, and also some temperature and some sweating. This is also a symptom. Loss of weight in the short period of time. Some symptoms that indicate that resistance forces of the organism fell. Also continuous coughing, also if there is some blood while you cough, and also loss of weight. And we work in the framework of the program to attract doctors of primary assistance, that they should work more effectively, and in order that people know about this. And the second part of the question is the responsibility of a person for his own health. we are accustomed that the state and the ministry are responsible for the policy, but when we are speaking about health, we didn't focus on the responsibility of the citizen. And this is a responsibility of the citizens of the country to be healthy. And Mr. Minister, he told us about information campaigns, and in the framework of the concept of the development of public health, one of the main components from 10 functions of the health ministry is the educational programs for the population that radically should change the attitude of people towards their own health. Can I add? For the information, and I have a personal example. I didn't have any symptoms myself at all. None. And I didn't lose weight. And it was accidental that they found out this. And maybe it would disappear. But they found out, and they started to treat me in order to heal me. And one more thing is important. You should be medically tested each year. There is a primary assistance system, and you need half hour of your life in order to undergo the test. So we are responsible for our own health. I cannot pressure you to do this and get these tests, but you can do this once a year and it will be good. If there's no symptoms and everyone is healthy and alive, it's okay. And the early diagnosis is very important in order to start treatment of oncology for different types. The first stage is curable. But unfortunately, this is the problem of post-Soviet states. When people address and they diagnose cancer too late. And these are third and fourth stages mainly. And doctors cannot help in this case. And in Ukraine, the situation is the same. So you are young people, but we are all coming from Soviet system, and we remember that state didn't ask us whether we should be vaccinated. We were just put in the corridor and injected with the vaccines. We have some scars from these vaccines, and we got accustomed that everyone was decided for us. And now the situation has changed, and we cannot pressure you to do this. For example, insurance companies, but there's no insurance, medical insurance in Ukraine. And of course, you should fight bad habits, and you should go and have some medical tests. And if you find something at early stages, it is all curable, including tuberculosis. Thank you. Thank you, Minister. Minister, thank you very much. We end our press briefing now. Thank you for coming. Until the next time, goodbye.